The initial 911 call would come into the police department. The call taker would take as much information as possible. We want to know exactly where they are. Is the person breathing? They'll run through the ABCs, their airway, breathing, circulation, to make sure that they are breathing. That's the main issue right now. And we do a multi-tier system in the city of Quincy where the ambulance, fire, and the cruiser are dispatched simultaneously. If it's the patrol officer, his main concern or her main concern is the medical condition of that person. Make sure that they're breathing and render any type of emergency medical services that they need at that time. Then, when the ambulance or fire arrives, who are either EMTs or paramedics, we will take one step back and assist them because they're the next level on the tier. Then at that point that the medical condition is under control, the officer will decide whether or not it's a law enforcement type situation, if there's any evidence that needs to be preserved or collected and so forth on that matter.
When we get there, it's certainly a patient care issue, and our focus when we get on scene is to be able to access the patient, treat the patient, remove the patient from the scene as quickly as possible, and take the patient to the hospital.
Best case scenario that we get the tip off immediately and get solid information that it is an overdose we're dealing with. So often we get kind of broken information at the point of dispatch, and frequently it gets type coded as what we call an unknown type EMS because of the fact that someone may be reluctant to give a lot of information initially at the point of dispatch in fear if they're going to get someone in trouble rather than understanding the gravity of the situation as being what it is, a truly life-threatening situation.